So I just want to welcome everybody to this wonderful event. I'm going to first start off by just introducing myself, a little bit about Liquivida, what we do in Aventura and downtown, before I introduce Dr. Brandeis, who we are so honored to have here, the creator, the founder of the P-Long Protocol, and one of the leading experts in America for sexual wellness. So just a little bit about myself. My name is Doug Patel. I'm the owner of the Liquivida Wellness Center in Aventura, Florida, as well as downtown Fort Lauderdale, which we just opened 3 weeks ago. And we have a full med spa and wellness center. Our focus is on IV therapy. We do wellness in regards to weight loss, regenerative medicine. We do sexual wellness, HRT, TRT. We have a medical aesthetics where we do the neurotoxins, the dermal fillers. We also have a esthetician, so we do skincare. So we are a full med spa and wellness center. And one of the things that we were doing for quite a while is trying to find the best way to enhance and help men, whether it's to do with ED or enlargement. There's many things that were out there. They were not safe. They were not proven. They were very expensive. And then a few months ago, after much research, we found P-Long. And P-Long has been an amazing addition of service to our program. We've had many men in the last 2-3 months sign up for the program, are absolutely elated with even the results they're seeing after 2 to 3 months. And so we really wanted to offer this to everybody else. And we were so fortunate and so lucky that Dr. Brandeis was able to come in and give us a live presentation about the P-Long protocol. So I don't want to speak any further. I'd rather introduce and welcome Dr. Judson Brandeis. Welcome, Doctor.
Oh, thank you so much. And, I wish I could speak with the eloquent accent that you have, but I have a California accent. Anyway, today we're going to talk about the honest truth about manhood enhancement. I'm Dr. Judson Brandeis. Let me tell you a little bit about myself. Well, first of all, I'm not advocating for men to increase the size of their penis, right? That's your decision. So nothing in here is going to be forcing you or convincing you to increase the size of your penis. But if you want a larger penis, I want you to do it in a way that's both safe and effective. And so we're going to talk a little bit about what is safe and what's effective and what's not safe and what's not effective. So just a little bit about me. I went to Brown University for undergraduate. I went to Vanderbilt for medical school. I did a year of Howard Hughes Medical Institute sponsored research at Harvard Medical School. And then I did 2 years of surgery and 4 years of urology. At UCLA, I came out, I was in private practice in Northern California. I helped pioneer surgical robotics. I built a kidney stone center. I helped pioneer MRI-guided prostate biopsies. And about 5 or 6 years ago, I became really interested in regenerative medicine for men for treating erectile dysfunction, Peyronie's disease, and penile enhancement. So, what are the goals of penile enhancement? First of all, it's got to be safe in both the short and the long term. People that get silicone or other synthetic tissue put inside their penis, it may be safe over the month or a year, but what's going to happen when you turn 60 or 70 or 80 and the tissue gets really, really thin? Is it going to extrude through the penile skin? You have to really think about the short term, but also the long term. If you're going to put something synthetic inside your body, what's it going to be like in 30 years? It also has to increase both length and girth, right? So if you just increase length, you get what we call a pencil penis. And if you just increase girth, you get what we call a pig in a blanket penis, right? So you want to both increase length and girth so that it's natural looking and symmetrical. And you don't want to break the bank, right? So you don't want to spend tens of thousands of dollars over a period of 5 or 10 or 15 years to enhance the size of the penis. You want it to be relatively inexpensive. And a bonus would be if it improved erectile function. That would be sort of the holy grail if you can increase length, girth, and function. And so we're going to talk a little bit about penile anatomy. Then we're going to talk about traction devices, fillers, fat transfers, ligament ligation, and cosmetic implants. And then we're going to talk about the P-Long. We're going to talk about what the technology is and also the results. At the end of the day, size really actually matters to men. right? Larger penis is the size of power, of fertility, of stamina, of being the alpha male. And when you survey men, at least 2/3 of men think that their penis is average, right? How can 2/3 of people be average? But out of those 2/3 of people, at least half want a larger penis, and the other half, I think, are probably lying. And so this is a goal for men, of men, and it's been that way since pretty much the beginning of time. So just taking a look at the anatomy of the penis has two erectile bodies called corpora cavernosa. Corpora is body, cavernosa is empty, right? So if you're dissecting these things on a cadaver, that spongy tissue is not going to be filled with blood. It's going to look empty, which I think is why they named it corpora cavernosa. And then you have a corpus spongiosum, which contains the urethra. That's the tube that you urinate through. And so in order to increase the size of the penis, you have to enhance the size of the corpora. And the corpora are lined by what's called the tunica, or the outer lining. And that tunica is made of collagen and elastin, which is a really tough tissue. And so increasing the size of the penis really means stretching the tunica and stretching beyond a normal erection, because otherwise the penis would keep growing with a natural erection. What you have to do is go what we call super physiologic, so beyond pressures that your body generates naturally to increase the size of the penis. Okay, what is an average penis size? I don't know who does these studies, but this is a study that showed the average penis size for men around the world. And I think the United States comes in at about 5.1 inches. So if you have 5.1 inches and you're in the United States, you're average. Now, if you're in Cameroon or the Sudan, you might be in trouble. And, if you're in Cambodia, you might be, hailed as a fertility god. But this just kind of gives you an idea of what the range of normal penises are. And most of the people that I see have a functional penis, meaning that it's long enough for intercourse and it functions to allow a man to urinate, right? Those are the two functions of the penis, is procreation and urination. But just like breast implants and calf implants and chin implants and every other cosmetic procedure that people have, men want to increase the size of their penis for whatever personal reasons they have. And in the P-Long study, it wasn't all guys with short penises. It was guys with short penises, medium-sized penises, and even above average penises. So just because your penis is above average size doesn't mean that you shouldn't do the P-Long study or the P-Long protocol. It just means that you want a bigger penis. So one way that men have been doing this for hundreds of years is traction devices, right? So it's got to cradle the penis. It's got to create tension to stretch the tissue. There are dozens of these things on the market. There are even penile weights, or there's a technique called jelqing, which is like a sophisticated way of pulling on the penis. There is one study out there that looked at the results out at about 6 months and showed that you can grow a penis in length for about 1 inch, but that's wearing a traction device for 6 to 9 hours a day, right? And so for most of us that have normal jobs, you can't wear a penile traction device for 6 to 9 hours a day. That's not really practical. And at the end of the day, you're only getting length, you're not getting function, and you're not getting girth, so you get the pencil penis, okay? Now, you can also inject fillers or fat into the penis to increase the girth, right? That's the pig in a blanket penis, right? So you're not increasing length, you're just increasing girth. And I have a couple of patients who I treat in my office that have had fillers, either hyaluronic acid or PMMA, that have a pig in a blanket penis, and they come to see me because they want to get length. And I've been able to add length to their penis so that their penis looks more symmetrical. But this is not without risk, right? And so there's something called the Darwin Awards, which recognizes individuals who have contributed to human evolution by selecting themselves out of the gene pool, by dying via their own actions. And, there's a story that posted about 5-6 years ago about a poor man who died during penis enlargement surgery after injected fat leaked into his veins and caused a heart attack, right? You don't want to be that guy. You don't want your friends to go back to the 20th high school reunion, say, oh, you know what happened to Joe? Oh, did you hear what happened to Joe? So, it's just to say that you want something, if you're going to do a purely elective procedure, you don't want there to be any chance of a bad outcome. Okay. So autologous fat grafting is fat is liposuctioned out of the body. It's centrifuged to remove the oil and the water, and it's injected back into the penis under the skin and above the erectile bodies to make the penis thicker. But I have a couple patients in my practice who have had this, and the penis doesn't feel normal. It feels squishy, right? You have a rigid erectile bodies on the inside, but the fat is kind of squishy. And so it definitely doesn't feel natural. You can also inject fillers under the skin and above the corporal bodies. You can use silicone, hyaluronic acid, polylactic acid, PMMA. These are costly procedures, around $10,000 for the initial injections. And then because you have to suspend the hyaluronic acid or the PMMA in water, over time that water gets reabsorbed. And so men that have fillers need to get re-injected every year or two at a cost of around $2,500. So this is, first of all, it's an expensive procedure. Second of all, you get kind of a lumpy, bumpy penis. And third of all, you're not increasing length, you're just increasing girth. And you're not improving function at all either. Okay. There are doctors that cut the suspensory ligament. The suspensory ligament holds the penis up. And so when you get an erection, it allows the penis to be at full mast. If you cut that ligament, when you get an erection, the erection will point down towards your toes. The reason people did this is because it looks better in the locker room, right? Your penis hangs lower. But over time, the suspensory ligament scars down, and then all of a sudden you have a shorter penis that points towards your toes. So I would definitely not recommend anyone getting a suspensory ligament release. And then there's the pneuma implant. So this is an FDA, it's not really even clear. The FDA sort of acknowledges that this exists. It costs about $15,000, $20,000. It's an actual surgery that takes a couple hours. And the implant is placed under the skin and above the erectile body, almost like a silicone taco. And this increases girth and it increases flaccid length, doesn't increase erectile length. But I have seen at least 4 or 5 disasters from this procedure in my office. And, one gentleman, 25-year-old male nurse, good looking guy, and he had a pneuma placed, got an infection, was in the hospital on IV antibiotics for a week, then had to have it taken out. And then he's had at least 2 reparative surgeries after the initial implant was taken out. And it's really been a disaster for him. So you don't want to take a perfectly good penis and do something that could hurt it, right? Especially to that extent. And so that's why I came up with the P-Long study, right? To give men an option that's safe and effective and reasonably priced compared to the other technologies for penile enhancement. So this was a study that took me 2 years to do. I did it, started before COVID, finished after COVID. COVID made everything a lot more difficult to do, but we persisted, and I was able to get 30 men with normal, healthy erectile function, right? This is not to improve erectile function. This is for men, 20 to 50 years old that get normal erections, that want better performance and size out of their penis. And this was IRB approved. It was listed by the NIH on the clinicaltrials.gov. It's been accepted for oral presentation at the International Society of Sexual Medicine and the Sexual Medicine Society of North America. and it was published in Andrology, which is a reviewed journal. So this is not like one of these marketing ploys to get you to buy an extends pill or something like that. I have research credentials. I did the research, published the research. The research was reviewed by my colleagues and accepted for presentation. So one of the linchpins of the P-Long is platelet-rich plasma, right? Platelet-rich plasma consists of a high concentration of platelets. Platelets in the body have two functions. One function is to cause a clot, but once the platelet empties out its contents and creates a clot, it also empties out growth factors. So it's a beautiful system the good Lord has created. The same cells that cause a clot and stop bleeding also begin to start the healing by releasing growth factors. So what we do is we collect blood, we separate out the platelets, and we extract about 8 cc's of PRP. And then I use an ultrasound to guide the injection into the corpora, into those erectile bodies, where it triggers the growth of blood vessels and the growth of the tunica tissue. So this is an ultrasound. Those two circles on the top are the corpora. And you can see in just a second, that is the main blood vessel, the deep cavernosal artery of the penis. Now we're going to swing back to the transverse view, and you're going to see the needle coming in at the 10 o'clock position. See the needle right there at the 10 o'clock position coming into the penis. And then very soon the PRP is going to be injected. You can see the PRP bubbling into the penis right here. There's a nice view of the artery. And so that'll be done on both corpora, both the right and the left corpora. Most of my patients describe the procedure as a 10 out of 10 on the anxiety scale and a 1 out of 10 on the pain scale. And I think that's pretty accurate if you're getting it done properly. So the lining tissue of the tunica is really the critical structure. And there are two layers of this connective tissue. There's a longitudinal layer, right, a lengthwise layer, and a circumferential or circular layer. And you can see on the right a cross-section of a ligament, and that shows lengthwise fibers and cross-sectional fibers. And so not only do you want to inject the PRP, but you want to use a traction device for length and a suction device for girth, right? So a traction device is going to pull the penis lengthwise, and we use the RestoreX device, which was developed by a friend of mine at the Mayo Clinic. There are really excellent studies showing that RestoreX works in Peyronie's disease patients and in men who have undergone prostate cancer surgery to increase or restore length, and works better, not just on its own, but better than the other traction devices out there. And then the other device that we use is a Dr. Joel Kaplan penis pump that creates girth enhancement, right? So we don't want just length, we want girth. And the nice thing about the Dr. Joel Kaplan penis pump is that it's got a gauge, so you can follow exactly what pressures you need to apply. And also it's a hand pump, so you're able to generate extra pressures, super physiologic pressures that go beyond the pressures that you would normally experience with just an erection. And then the Affirm nitric oxide booster helps increase circulation and helps increase nighttime erections, right? So Affirm has citrulline, which your body then turns into arginine, which is a nitric oxide donor. And then it also has beets and ginseng and murepuama, which are nitrates, which then can convert it into nitrites and then into nitric oxide. So nitric oxide, when I was at UCLA, one of my professors won the Nobel Prize for discovering nitric oxide's role as a second messenger in blood vessels. Your nerves release nitric oxide, which helps open up blood vessels. And it does that all throughout the body. So nitric oxide boosters help with muscular function, like all elite endurance athletes and bodybuilders use nitric oxide boosters. It helps with brain function, especially in men over the age of 60. It helps reduce blood pressure naturally, and it improves genital circulation. And I'm actually doing a study now called the CONFIRM study that's showing that if you take nitric oxide boosters like Affirm before you go to sleep, you get better nighttime erections. And that's the function of Affirm in this study, was to improve erectile function. The more erections you can get, especially when you're using the PRP and traction and suction, the better off you're going to be in terms of outcome. And the nice thing also is that there are no negative side effects of Affirm. It's all really positive. So what is the final P-Long protocol, the protocol that we tested, right? And so there's one protocol that we tested, and I'm confident that the results of the P-Long study will be pretty much applicable to everyone. Of the 30 patients that underwent the study, everyone achieved some degree of growth in length, girth, and in function. So if you follow the P-Long protocol to the letter, you can expect to have improvements in both length, girth, and function to, some degree. I have people that come up and say, what if I pump more? Or what if I pump less? Or what if I use stem cells? Or what if I use platelet-rich fibrin? I mean, I get asked all sorts of questions, and my simple answer is, I don't know, you should do the study. Right. So there's going to be a lot of people that make all sorts of claims that they can do X, Y, or Z. But I would look them in the eye and say, have you done the study? Or has somebody done the study to approve what you're saying? And 9 times out of 10, it's unlikely that they've done that study. So I did the study, and this is the protocol that I used in the study. And if you use this protocol, you can expect to get the results that I got. So I use a double spin PRP once a month for 6 months. Now, I have patients who, after the P-Long study, wanted to get more length and girth and function, and they've come in on month 7, 8, 9, 10, 11, 12, and they're continuing to get increases in length, girth, and function. So just because the P-Long study was 6 months doesn't mean you have to stop at 6 months. It means I had to stop at 6 months because at some point I was able to prove statistical significance, and I wanted to publish this and get it out into the literature. But that doesn't mean that you have to stop at 6 months. You take the Affirm nitric oxide booster, 2 tablets in the morning and 2 tablets in the evening. You use the RestoreX traction device 20 minutes in the morning and 20 minutes in the evening. And the RestoreX is pretty easy to use. You just put it on and then, forget about it. Read the newspaper, watch TV, whatever. I mean, I wouldn't take it to work with you, but if you want to sit in bed in the morning and put the traction device on and watch the Today Show, it's perfectly fine. And then the use of the penis pump, and the protocol on the penis pump is pump for 1 minute, release, pump for 1 minute, release, pump for 5 minutes, release, pump for 5 minutes, release. And the reason for that is you want to stretch the collagen and then release and relax it and then stretch it again. And each time you stretch and relax, you're going to get a little bit of extra stretch or extra length or girth out of it. And so, and then we measured once a month, both length and girth for the 6 months of the study. And the results were really remarkable. We got 0.8 inches in length and almost a 1/2 inch in girth over that 6-month period. And you can see that our data, the growth was fairly linear. I tried to look at whether people grew more in the first 3 months and then plateaued, or people didn't grow in the first 3 months and then started to accelerate. And really, I wasn't able to define a pattern of growth. Whether people grew early or late was a relatively random outcome. So in conclusion, most men have a penis that's adequate for intercourse and adequate for urination, which are basically the 2 functions of the penis. But there are a lot of men that are interested in enhancing the size or function of the penis, and the P-Long is a safe, right? Because I didn't have any negative complications of the PRP, the traction, the suction, or the Affirm. So this is a totally, totally safe way to enhance penile size and function. There's a low level of satisfaction with traction devices because you have to wear those things for 6 to 9 hours a day. The fillers are expensive, they get reabsorbed, and they give girth but not length. Pneuma gives some very serious complications in certain cases, and hyaluronic acid and other PMMA fillers, they just give girth but not length. The P-long, on the other hand, there were no adverse effects at all from the P-long. And it can grow your penis almost an inch in length and half an inch in girth. And if you want to go beyond the 6-month period, really the sky's the limit. In biologic systems, especially soft tissue systems, things are malleable. It's just like when your orthodontist moves your teeth, you can move and stretch body tissues, or folks that have those giant earrings in their ear. Soft tissue is in the body, it's biologic and it's malleable. And if you apply pressure for a long enough period of time, you can change the length, size, and shape. And the penis in P-long is symmetric and natural looking, right? It's not a pig in a blanket penis. It's not a pencil penis. And the other thing is, there's a psychology of cosmetic procedures, right? And I think people are looking for not just size, but also the self-confidence of the person. It's not just the penis, but the person attached to the penis. And if someone senses, gosh, this guy's so insecure that he's got to put a big silicone taco in his penis, or he's got to inject filler into the penis, the person attached to the penis maybe becomes less attractive than the actual penis. And this, relative to the other penile enhancement procedures, is fairly inexpensive, about a half to a third of the cost. And the real bonus is a boost in the function due to the PRP. So there have been 4 studies looking at PRP injections in the penis. 3 of them showed improvement, and 1 out of the University of Miami showed improvement, but also showed improvement of the placebo that was the same as the improvement with the PRP. And their conclusion was that PRP didn't show benefit. My question to them at the Sexual Medicine Society meeting is, what were you putting in your placebo that made the placebo so effective? But the studies looking at PRP either looked at 2 or 3 injections to improve